everyone. Welcome to the vaccination COVID-19 use case. Today we'll be following the story of Isabella, who is a traveling nurse, as she goes and gets her vaccine doses for Pfizer. Today we'll be showing a wide variety of interoperability, from the actual administration of the vaccine to the research that happens of how that vaccine is performing and the state and national level of vaccines across the country. So today I'll be acting as the PCP, and we'll have Isabella come in for her first vaccine dose. Of course, we're going to first make sure that her information is up to date, having the most up-to-date vital signs, as well as confirming her allergies to rubbing alcohol and Neosporin are still accurate. She confirms that for us, and then we go and make sure we have her up-to-date immunization information from the registry. We check this by performing a query to the state registry with HL7 version 2. This will pull her up-to-date vaccines from the Washington state. Here we can see she's gotten a flu shot, and we're going to reconcile these into the chart so that her record is up to date. With all that information squared away, we're going to go ahead and give her her first dose of the Pfizer vaccine. And I'm going to add a lot number here and get all this information up to date. All right, and on that administration, that's going to send a message off to the state registry so they have her latest dose information. Because Isabella is a frontline worker, she's agreed to participate in a research study about how the vaccines are performing, since she is one of the first to get the vaccine doses. With that, I'm going to perform a Smart on Fire launch to ICON and hand it over to Ashish to tell us more.
Thank you, Danielle. I'm Ashish Bhandari with ICON. We are a clinical research organization that conducts clinical trials. And what you're seeing on the screen is essentially an embedded version of our Prism EDC system, which is the trial database. Normally what would happen is at the site, the user would enter their data in their EHR system and then have to bring up another window with the EDC system and transcribe that data manually, item by item. In this case, let's use, in the screening visit, we'll go for vital signs, and we notice there is nothing entered yet, so we add a form. And what you'll see is that data has been brought in from the EHR in a pre-populated manner. We can select which set we want, and once we click OK, it's automatically filled in using a validated methodology. And as a result, there's an icon against each data element that indicates that this is considered e-source by the FDA. The advantage of that is the data is entered with full accuracy and greater speed. It reduces the load on the site, as well as on the pharmaceutical sponsors having to go verify that data. Now, if we hit submit, and we're done. The data is now in the Prism system, and on my screen over here, we can verify that by simply refreshing Isabella's record for the vital signs, and there we go. We have it in there, and can see that the green background indicates data that is considered e-source by the FDA. Thank you. Back to you, Dave.
Thank you. All right, so Isabella's just about done with her stay at the PCP. And so before heading off, we let her know that she can, of course, see her COVID information in her MyChart patient portal. Today, she's only received that first dose. And so while this is a vaccine VCI health card that she can, scan to get her vaccine information, it won't be fully up to date yet with her 2 doses until later in the show. Taylor, over to you.
All right, we are going to fast forward, and it is time for Isabella to get her second dose of the COVID vaccine so that she can go on site for her job with Nurses on the Go. Isabella is not a patient that we have seen before, so during admission, we have sent a query out to an HL7 query out to the state registry, as well as to cross-community connections like Commonwealth and Care Quality. We are using the seamless exchange solution to do this simultaneously. Upon admission and reviewing the chart with Isabella, we find that we have some outside records for allergies that have been unverified. So we launch our new modal window to see the longitudinal record on the left, which is considered those outside records, and our local record on the right. We will verify that she does in fact have these allergies to rubbing alcohol and Neosporin. And we can look and see that this was transmitted from the EPIC community HIE, and we can go ahead and add this to the chart. We are notified that there is a required field that is missing, so that we will go ahead and review what that required field is. If we were to look at this document here, we will be able to see some different elements of the allergies that may give us an indication as what is missing, but it does appear that this is a free text allergy and we need to codify that. So I'll go ahead and select Add and search for, in our system, Neosporin. And this will select the multum code that we can add this to the chart. So I'll go ahead and select Save. And now we have the two outside records added to the local record. I'm going to go ahead and talk about how we can mark this as reviewed for promoting interoperability purposes. This button would increment their score for meaningful use or for promoting interoperability. Now, looking through the histories of the immunizations for the patient or for Isabella, we'll go ahead and select View Records. This launches a similar modal window with the local or the longitudinal record on the left and the local record on the right. We can review these different elements and add them to the chart to create a historical data of her immunization schedule or her immunizations. And we see the first dose of the COVID vaccine here from the EPIC community HIE, but the transmitting source is the state registry. This is showing that we have been able to query both the registry and the community HIE and create one line item for the provider to have a better sense of what to be adding to the chart. We will see that there are related outside records that does have that similar view document that we saw previously. I'll go ahead and add this to the chart and close out of here. And now it is time to administer Isabella's second dose of the COVID vaccination. To do this, I'll select Add, Order Immunization, and select Ambulatory In-Office Med and the Pfizer-BioNTech COVID-19 vaccine. I'll enter our provider information, select OK, and close. This is now part of our scratch pad, and I will go ahead and sign this. And now I can administer the actual vaccination. This first window is for if you were to be scanning, say, a wristband of the patient. We do not have that today, so we'll go ahead and select Next and select the window and actually scan the vial. This will pre-populate manufacturer information such as lot number and the Pfizer vaccine or Pfizer Inc. manufacturer and the expiration date. All we have to input is where we administered the actual vaccine. Select OK and sign. This will send back to the state registry, the HL7QBP, and they will be receiving that soon. Since Isabella is going on site, we do want to talk about the fact that she does have the ability to download the VCI vaccine card. So we'll sign into her patient portal. From there, you'll see My COVID-19 Center. And both doses of her vaccine have been received. And we can view the vaccine verification card by selecting this button here. This will send off that FHIR API where it will generate the actual VCI card for her to download to her own device by taking a screenshot of it or printing. From here, she would be able to do, as I said, download or print, and then she can share that with her employer. And with that, I'm going to pass the ball over to the state registry.
Hi, my name is Ashley McDonald. I'm with STC Health, and we represent the software production for the state of Washington, as is in today's use case scenario, and also almost 50,000 pharmacies across the country. And in continuing with Isabella's case, what we are looking at first here is her consumer record within our system. This is MyIR, our consumer application, and one of the things that I want to point out here is you can see as we scroll down towards the bottom, it does indicate her 2 COVID vaccinations, but in addition to that, we also have a look at her vaccinations throughout her lifetime. Additionally, MyIR can record numerous lab tests, so it is more of a collective record of her health history that is stored in the registry. Also, there are still needs to have a paper record of these vaccination events. And through MyIR, there is the option of having a PDF record that is printable. The most common needs for this are school registration, university and college registration, other government requirements that still sure like to have that paper record of the vaccine event. So we do provide that in addition to a soon-to-come QR code. Additionally, continuing on with Isabella's story, Isabella is now going to see her mother who lives in an assisted living facility. If you remember the beginning days of the COVID response, you know that our U.S. pharmacies played a large role in vaccinating the populations of the long-term care facilities. And Isabella's mother, Maria, is one of these residents of a assisted living care facility unit, and we can look at her vaccinations through the software that many of our pharmacies use. And as we see here, looking at her record, thank goodness she is not due for anything now. She is up to date. But as we scroll down, we can see the 2 COVID vaccinations that Maria has had. So she is up to date. They are 2 weeks post-vaccine, so she is good and clear, which is a good thing because despite the fact she is in an assisted living facility, she is still a very active adult and she is going to work. But to go to work, she needs an entry pass, and the registry and the data contained within the registry also is available to partner with third parties and provide such entry passes that can be used for places of employment as well as for travel, concerts, sporting events, and other areas where there are large population gatherings. So as we create her entry pass to go to work, we're going to pull her information about her COVID vaccine. In this case, we are partnering with Bindle to pull her records. And she works at the paper crane factory. So we are going to select that, create that entry pass, and here you have the digital pass for Maria to enter into the workplace. Additionally, another benefit of the registry is that it does provide the state with the up-to-date daily information about the COVID vaccines that they have administered. So in keeping with our use case, we have the dashboard for the state of Washington. And you can see here that Washington has administered almost 3 million vaccines as of now. They've got several that are waiting to be processed and several others that have some errors in there. Those errors will be identified. The message is sent back to the providers to be fixed, and then they can be reprocessed into the system. As we scroll down, the state also has information about the individual providers that are administering these vaccines. We can look at the individual providers, see how many total vaccines they have administered, any that are processing or with errors, and identify any information that may need to be updated that way as well. Additionally, another service that we provide for the states that work with STC is a way to report to the CDC on a daily basis. We all know that the national numbers are being tracked continuously, and the states are required to report on this on an ongoing basis. So for the sake of time, I have already pulled up the portal. We have got a fictitious file for viewing purposes today, but this is very representative of reality, and you can see one of the things that is very important is the identifiable information for any individual has been redacted. So the point of this submission is really to track at the geographic level. The total counts can be counted by the state level, the city level, the county level, the zip code level, but again, it is not intended to be an individually identifiable way of tracking people. Additionally, I wanted to finish up with the information about this CDC count by passing along some information from the CDC. They were not able to join us today, but did want to pass along some information. So let me change my screens and we'll pull that up. All right. The file that is used to transmit the daily information from the states to the CDC is called the CVRS. And this slide deck does have some important information about the CVRS. The CVRS submission is a nationally coordinated approach. It is a way to collect and analyze public health data, and it is standardized for all people who are submitting these entries across the country. The entities report their COVID vaccinations in a unified way as to collect the data in a way that makes it easier to report on in a more structured format. The CVRS does contain 45 data elements, and it is reported daily, including weekends and holidays. And it is designed to count the total doses administered by states, territories, and other select federal entities. It is also designed to count the number of total of people fully vaccinated across the country, and this can be broken down by vaccine type, so Pfizer, Moderna, Johnson & Johnson, and any vaccines that are added in the future. Manufacturers that add COVID vaccine possibilities, they will be tracked as well in this formatted way. So with that, I wrap up our information today. We want to thank you for participating via video in our interoperability showcase, and stay healthy, and thanks so much.